Hi everybody. Yeah, so this is my third video of the channel so far, and this video I want to talk about the latest scan that I had for my cancer treatment, lymphoma to be more exact. It's non-Hodgkin's lymphoma, and yeah, apparently it was a success, right? So if you follow me on Twitter, okay, I actually changed my Twitter handle to Skinny Garlic, so it's easier when you tell people, you can just verbally tell people, what's your Twitter handle, Skinny Garlic, or if you, on YouTube, what's your YouTube channel, Skinny Garlic, rather than Skinny Health Journey, and there are certain words missing, and so I think this is easier, Skinny Garlic, yeah. So anyway, garlic is one of the most powerful anti-cancer food, not just for cancer but for a lot of other things. And yeah, anyway, treatment was a success. The PET scan came out negative for lymphoma, right? None of my lymph. Okay, that's actually a very good zygote 3D human body. There's a very good website called zygotebody.com. Yeah, so you can go to zygotebody.com, and if you ever want to see all the ins and outs of a human body, or if you feel some pain in your abdominal area, you can switch it in. It could be a muscle problem. You could zoom in and you could okay, what could the problem be? Where is in the abdominal area? It's what's the problem? Is it near your rib cage? Your rib cage, then maybe it could be the stomach, it could be the liver. So you can see where the liver is, right? Sometimes you have a pain right under the rib cage, and you'll be like, okay, what's that? Maybe it's the big intestine. Maybe. But of course, you don't self-diagnose yourself, right? But anyway, what I wanted to say was that. Yeah, so my nose. Okay, let me just go to the PET scan, right? So it's easier for you. Where's that? Okay, so I'll just show you the report first. My treatment actually started in March, right? So okay, let me just. Okay, my treatment is like that, right? For normally for cancer treatment, there are three things that you do. You call it burn/poison, right? Burn is radiotherapy, slash is surgery, poison is chemotherapy. So it sounds very scary, but this is how it works, right? So I did not do surgery. I did surgery is actually slash, right? So I did burn and poison. So I did radiotherapy here and on my neck, which is a bit funny, but I'll talk more about it later. And yeah, the chemotherapy and radiotherapy is 2 cycles of chemotherapy with 7 weeks of radiotherapy, and then another 2 cycles of chemotherapy. It's called a sandwich by chemotherapy. So and treatment was actually a success. Actually, when I was going through two chemotherapy treatments before I started radiotherapy, it was actually gone. It was already gone. But the doctors were saying you have to go through everything. So of course I go through the 7 weeks of radiotherapy and another 2 weeks of chemotherapy to complete the treatment. So yeah, I was thinking if I was feeling okay and all, I wanted to add another cycle of chemotherapy to make sure. Just to excuse me, to be safe. So anyway. What am I talking about? Right. So it was good. August 24. So I think I'll just show you my. Ta-da! So this is the the details are blanked off, right? And yeah, actually, you can just go to the impression compared to the previous 18F FDG PET scan. Is a PET CT scan, right, dated 28th of February. The metabolically active lesions in the nasal cavities and the left cervical nodes are no longer seen. No other significant changes. The scan findings are in keeping with complete metabolic response to therapy, which means it's completely gone. This was 28th of February, right? It was 2 months later. Normally, a cycle of chemotherapy is 3 weeks. 1 week of chemotherapy, 2 weeks of rest. Yeah, because once you poison your body needs to recover a little bit. Usually, after 1 week, you feel a bit crappy, on the second week, and by the end of the third week, you feel a little bit better. But then the next cycle starts already. So yeah. Anyway, this is the CT scan. You can see this is the kidneys. This is my balls. And you can see the date here, February 28, right? And this is April 14, which is about roughly 6 weeks later, 7 weeks later, right? You can see over here, right? Can you see the mouse? Yeah, I can see the mouse. You can see here, right? The black stuff here. It's yeah, that's that's the problem. And after that, yeah, it's cleared, right? It's no longer dark, right? Yeah, moving on to the next picture, you will see that over here on the nasal cavity, my nasal cavity, you can see that it's blocked, right? And then this is February 28, right? April 14 is really clear, so you can see the comparisons, right? I think there's something blocked here as well, but yeah, after chemotherapy, it cleared, everything cleared, right? You can see over here, there's something lighted up over here, something lighted up over here, but nothing's lighted up over here, right? Because cancer is very, it takes up a lot of that dye. I got injected with a certain glucose, and yeah, cancer takes out a lot of it. And yeah, it's no longer lighted up. You see inflammation. This is the brain. Brain also takes up a lot of glucose, right? Yeah. So you can see here. Yeah. So this is like this is almost already a 10. Yeah, but the thing about what the doctor told me was that on February 28th, before I started treatment, was that my tumor burden was actually quite small. Mine is considered as a early stage, right? So in anything in life, not in life but in health, you want to catch it at an early stage, and yeah, mine was early stage. I presented with blocked nose, and yeah, I just went to the doctor. I was thinking maybe I could cure it myself by sleeping it off, but apparently I couldn't sleep it off. Yeah, and it just got worse, and yeah, and so one thing led to another, and yeah, it is right. Yeah, there's some inflammation at my gums area, but yeah, see, it's cleared. February 28, April 14, it's gone. It's just gone. It doesn't light up. There's nothing lighted up. That's the thing about lymphoma. Lymphoma is very sensitive to that glucose dye, right? It's it's called FDG. That's FDG. It's called, where is this? Yeah, fluoro D glucose, right? So it's glucose. Anyway, yeah, so it's clear, right? You can see here something here, but there's nothing here. There's something here, but there's nothing here. So it's cleared. It's cleared. Actually, 2 months. I mean, like 6-7 weeks later, it's cleared. And yeah, but I had to go through it. There was another thing that the doctor saw. There was a dot over here, just a tiny dot over here, and the doctors were not sure whether this is anything or not, whether if it's worthy to do anything. But my radiation oncologist was saying to be safe, we just do it. So I had to go through radiation therapy on my neck, on my left side. So yeah, so now that's why I'm experiencing some side effects, which is the muscles here are inflamed, right? So yeah, it was really clear. I was telling the boys in Discord, and yeah, it's in April they already knew that it was cleared, but I just wanted time to rest, for time for myself, and yeah, so that's why I had to sacrifice YouTube, right? Anyway, so I think that things are really clear. So I completed the treatment. I went for radiotherapy, and then I completed the 2 chemotherapy cycles, and after that I started feeling like, okay, maybe I'm not, maybe we should just stick to 2 chemotherapy, radiotherapy, and then 2 chemotherapy instead of adding another chemotherapy cycle. We was like, okay, let's just stop here. So yeah, so this is NKT cell nasal lymphoma. This is my to be exact, yeah, this is not exactly, but it's extranodal NKT cell lymphoma. It's ENKTL for short, ENKTL. Yeah, so this was the end of treatment. I ended treatment in July, and 1 month later, I did a PET scan, right? And yeah, the words The last sentence was the best. No evidence of 18-FDG avid lymphomatous disease is seen in this scan, which is great. Yeah, but there's some, inflammatory changes involving the left scalene muscles where I received radiotherapy. So let me just show you. Yeah, you can see here, right? Slightly black in color. This is the one in April, not February. The one in April, right? It's clear, but here you can see it. My balls. And yeah, I can see it here. There's something here, right? Yeah, my gums here still inflamed. So these are stuff I have to live with. Not live with, but yeah, it takes time to heal though. I read that it takes from 6 months to about 2 years to fully heal, depending on the person. So 6 months will probably be February next year. Yeah, so we'll see how it goes. Anyway, I'll be seeing my doctor every 3 months. The thing about lymphoma is if it doesn't come back in 2 years, then you're good to go. You are good to go. But they don't say that you're cured, right? But you're good to go, right? The chances of it coming back is very, 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 very small. So yeah. Anyway, yeah, still clear. Things are clear. It's clear. There's just nothing. And I went to see the ENT as well. So the ENT took a scope into my nose, and the ENT said, "Yeah, there's nothing. The nasopharynx. This is a nasopharynx. Okay, you can see it. So the nasopharynx is yeah, you can see it now. So the nasopharynx is good. It's clear. Everything is clear. The turbinates. There are some some crust here and there. Yeah, but basically the doctor was saying that you're good to go. So yay! Treatment was a success, right? So yeah, there you go. I think I'm gonna be going back to doing my regular videos. I've already Skinny Moon Hunter YouTube. Yeah, I've neglected it for too long, so yeah, I'll probably go back to it. I have some news. That was 6 months ago. Yeah, so normally chemotherapy treatments would last, not chemotherapy, cancer treatments. Yeah, it's usually 6 months usually, but mine ended in 5 months. So yeah, good response. Early stage. Chances of it, the treatment being a success is 80%. So yeah, I think it's not too bad. And the tumor burden, according to the doctors, is a very small tumor burden, right? They were saying that this is a very small tumor burden. Doctors were saying that there are other people whose tumor is actually really huge, that presses on their eyes, and when they move their eyes, you could tell that, let's say for example, your right eye can't really move your right eye, and after treatment, once the tumor shrunk, they can move their eyes again. But yeah, when it was there, it was quite big tumor burden. So yeah, so that's why the doctors were saying that yours is a small tumor burden. So I guess things should be much better. In terms of chances. So yeah, but not everyone is the same. Everyone is different. But yeah, the treatment is good. Yeah, so that's extranodal NKT cell lymphoma. The treatments, if I got this like 10 years or 15 years earlier, I think the outcome wouldn't be as good, but yeah, since then, things have changed. For treatments, a lot of things have changed, right? Even radiotherapy, they could avoid my eyes, they could avoid all the critical areas. They could avoid my spine and all. It's very targeted. So yeah, things are good. I think I will return to my YouTube channel and talk more about it. And yeah, you'll find me being more active. Hopefully, I can also grow my health channel over here. So yeah, all right. I guess that's it. And see you in the next video. Right? See you. Ta-ta.